channel. Today I am going to be doing a nurse rant on night shift. So I've worked night shift my entire nursing career, and I just want to kind of start off the video with telling you guys exactly what is night shift. So depending on the facility you work at, night shift is 11 p.m. to 7 a.m. or 7 p.m. to 7 a.m. in the hospital settings, because nowadays it's more 12-hour shifts than 8 hours, 5 days a week. So that's what night shift is. It's definitely different than day shift. So I was gonna do a little bit of like pros and cons of working night shift, but I kind of just want to do a little bit of a more factual video, because having less management at night may be a positive to some people but a negative to others. So I'm just gonna dive right in and do a little bit of facts. So especially in smaller hospitals where I've worked in my career, you definitely have less staff at night, and that's going to be across the board no matter where you work. It's going to depend on what staff are actually present if you're in a bigger facility, but overall you definitely will have less staff. So especially in the smaller facilities, you are definitely not going to have transport at night, especially after a certain time, like 10 or 11. You may not have a secretary depending on the facility you work at. You may have less aides. Your manager is definitely not going to be there most of the time, no matter what facility you are working at. The doctors are not really around. There's really no specialists. There's the hospitalist at night, so the OR team's not really around. They're on call, so if something emergent happens, they get called in. Pharmacy is usually not there after a certain time, and this all depends on the type of facility you're at. Where I worked in the hospital, both the hospitals I've worked at, we have, well, this first hospital I worked at, after about 10 o'clock, it would go to what we called pipeline. It's more like an online type of pharmacy, so any new orders we put in the computer would be verified from that like online hub pharmacy, and then our pharmacy would take over in the morning. So it's not like they could bring you any medications, they're just verifying orders and things like that. And that's the same where I work now, except at 10 o'clock our physical pharmacy leaves, and then I'm part of a larger health network, so then one of the larger hospitals close by, their pharmacy takes over. Again, it's not physically delivering medications, it's overseeing and profiling medication orders. If we really needed a medication, we would then get it what we called carrier pigeon or whatever, where they would bring over a medication that was not stocked in the Omnicell or Pyxis, or something that's premixed by pharmacy, and then they would bring that to us from another hospital. That is very expensive, and most of the time we do not do that unless it's something that's the patient's in critical condition and they need to have that now. So that's a really big difference. So it doesn't have the convenience. If you don't have a medication, you have to call a supervisor if you get a new admission and you're kind of mixing some antibiotics with the saline or D5 depending on the orders, rather than getting the pre-mixed beautiful antibiotic that day shift or pharmacy will prepare otherwise. So that's a little bit the less staff, and it does have its pluses and minuses. Going along those lines, it kind of creates more teamwork at night, because all the nurses kind of have to help each other, because we are kind of all in one. We're being a secretary, we're being an aide, we're being a transport, so it's definitely a different type of feel. It is, people like to think it's generally slower at nighttime, and it's not necessarily slower, because most admissions from what I've seen are at nighttime, and that's not every single place, it's not every single day, but overall a lot of times there are more admissions at nighttime, and that's just because ERs are held during the day because they're waiting for patients to be discharged and having those beds available. So about change of shift and the beginning of the night shift, you get a lot of admissions like that. Think, okay, it's night shift, your patients are sleeping, so you really don't have to worry about much. And sometimes they do sleep, yes, and you don't really want to bother them, but at the same time, some of them may have sundowners, so they're acting crazy, and they are confused, and at nighttime they don't know where they are. They wake up and they get even more confused in the middle of the night, and they think, where am I? I'm gonna go home, like, get me out of here. Like, and the family members are not around during the night to help console those people and see a familiar face. So you don't have those family members and everything to kind of watch the more confused patients. So they definitely have a higher risk of falls during the night. Patients wake up and have to go to the bathroom. Try to turn the light off so they can get some sleep. And you just keep them Lasix, and then some patients might take a sleeping pill. So just have some higher risk at nighttime for falls. I guess I would definitely say that. Another difference and something unique to night shift is that because there aren't doctors around, there is the hospitalist, and that doctor is for any patients that are new admits during the night that have the hospitalist as their provider. They will then assess the patient, do their med rec, and put further orders in. And if there's a hospitalist patient if there's a patient who has a hospitalist as their attending, you can go ahead and get orders from them. Where I work now, some of the hospitalists will put in like Tylenols, Zofrans, cough medicine, things of that nature for patients who have different attending doctors, just because it's something you don't want to necessarily have to call the doctor for at 2 a.m. to get Tylenol. So things of that nature, depending on the doctor who's on them, everyone's different preference. They can give you orders for that. That did not happen in the other facility I worked at. You had to call the attending even if it was for something stupid like Tylenol at 2 a.m. because the patient had a really bad headache. You would have to call the attending. So that does have its perks. So you definitely want to have, when you see on your assignment that you have some hospitalist patients, it makes your night go a little bit smoother knowing that you do have that patient's doctor in-house. And if not, you would have to, if you got a mission that was not a hospitalist, then you would have to then call that doctor in the middle of the night and get the orders. Depending on the doctor, they might not give you much and just wait till the morning, which can be frustrating to you and the patient because they're asking for all these things and the doctor doesn't want to do it at night. And creates a different admission than if they were just a hospitalist patient because they can get everything taken care of. And it's kind of sad. I feel bad for the patients when you call the doctor, like, oh, let's do it in the morning. And they didn't get their bedtime medication, so you have an unhappy patient sometimes. And some patients don't care, like, oh, it's okay, I'll just wait till tomorrow, I don't really need them, okay. But if they have seizure medications, if their blood pressure's high, or if they have AFib, then make sure to get their cardizem, their Eliquis, anything pertinent to that patient, you want to make sure they do get for their bedtime dose if they missed it, if they've been waiting in the ER all day. Another thing about night shift is that it definitely affects your sleeping schedule. You have to kind of sleep before you go to work like you would if you work day shift. So I try to stay up as late as I can, like 3, 4, 5 in the morning, go to sleep, wake up around 3, shower, get ready for work, and go ahead and go. And then when you're off, unfortunately, it's not just like a day shift job. You kind of miss a half a day because you're sleeping your day off. And then you just have a couple hours at nighttime before you feel like you have to go back to bed because you're now off and on normal time. So it kind of throws off your schedule like that, and you're tired and just groggy and has some pretty serious health effects over time. If you work night shift, it's said that you will have a higher risk of hypertension, higher risk of diabetes, strokes, heart attacks. Your whole rhythm's thrown off, and at nighttime we're not necessarily eating the best things. We want to eat something that's quick at work, so if there's muffins in the back, if there's cookies, we're going to eat them, and it's like 2 or 3 in the morning, so our blood sugar is that's all your risk for diabetes and things of that nature, because your body normally wouldn't be eating at that time, and you can get the gist of how it just throws everything off. But the plus side of that is when you work night shift, you do get extra money, and that is dependent on the facility, no matter where you work at a hospital. And I've never worked in a nursing home, but I believe it would be the same way. You do have a night shift incentive, or night shift rate, and that's dependent on your facility, how much that actually is. I worked somewhere where it was 15%, so it ends up being like $3 or $4 per hour. And then where I work now, it's at 10%. Some of them have different, like it's 10% from 7 to 11, and then 15% from 11 to 7 a.m. And then in your paycheck, it's probably about a $200 difference for working night shift. And that's a bill. And for some people, $1 is a couple bills. That's your extra getting your nails done or whatever that may be, just for the inconvenience of working night shift. And I say inconvenience because most people are like, oh, you work night shift, oh, you're a nurse, that's why you want to work night shift. But I truly enjoy night shift when I'm working at the hospital. It's just outside of work, sometimes it's a little bit frustrating when you have missed sleep or you're tired and you're just kind of cranky like that. I keep touching my face, I'm sorry. But when I'm at work, I truly love working night shift. I'm actually there. So it is a bit of an adjustment, but I really do like it, and I don't think, at least right now, like it'd be really nice to say, okay, I would work day shift. But if I work day shift at the hospital, I feel like I would like my life outside of work, but I would not like work when I'm actually there. And one more thing I forgot to touch on was the medications. So generally speaking, I see this as a positive. Working night shift, generally speaking, you have less med passes than if you work day shift. So any of the patient's daily medications, which most medications are daily meds, and what happens when a patient takes a daily med, it gets profiled for day shift, and it's either 8 or 9 a.m. Some facilities might be 10 a.m. for the daily meds, so you don't have to worry about any of those. And majority of, like I said, majority of patient meds are daily meds that you would end up passing, like, depending on the comorbidities of the patient, 10 or more meds at 9 a.m. And if you do that for 6 patients, that's super time consuming and trying to get everything done. At night shift, we have the bedtime night pass, and that's usually around 2100 or 9 p.m. And that's mostly any blood pressure medications, always the cholesterol medication, any statins they take at night, Levemir long-acting insulin, and things of that nature. Sometimes gabapentin, sleeping pills, or Lyrica. We use Cinex, anything people would get 4 times a day, PRNs, fluids. The only thing that's a little bit different is antibiotics. Sometimes they're hung at like midnight, we'll start an antibiotic, or we'll have a Solumedrol at midnight if it's every 6 hours. So overall, it's a huge 9 p.m. med pass. Mostly all your patients will have 9 o'clock meds, and then maybe 1 or 2 have a midnight med pass, and maybe a couple have 6 a.m. or 5 a.m. meds that you can combine in one. Now your med, I think I would say that midnight has like the least amount of med pass. It's either like Solumedrol, IV Lopressor, or an antibiotic. For the most part, people aren't taking any of their home medications at midnight, so it's anything new for them in the hospital that we're treating them for. And then at 5 or 6 a.m. you would be giving Synthroids, heparin for VTE, and sometimes I've given Imdor or different cardiac meds in the morning as well. Other than that, you don't have to worry about daily meds, so you only have to give insulin once. So that's kind of a positive. Less room to make medication errors, more time charting, and I feel like at nighttime you can really just take that time and look at the chart more and figure out the bigger picture, what's going on with your patient, so you can give a good report to day shift. And that's how I would kind of sum up working night shift. I do enjoy it for the most part. With anything, it has its plus and minuses, as you guys can see, and you just have to kind of figure out if it's right for you, but I definitely wouldn't knock it down. Give it a try. It's not that bad, and yeah.